Good afternoon. Welcome to number 6 Commonplace for this afternoon's daily press conference. The number of samples for COVID-19 taken in Gibraltar to date is 2,626. We have received 2,407 results, and these show 13 active cases out of 144 confirmed cases of COVID-19 to date. That is an increase of 3 cases. No one is in hospital with COVID-19 today in any ward or indeed in the ICU. Our Nightingale ward remains available but empty. My dear friends, on the 17th of March, I stood before you and announced that we would lock down our over 70s for their own protection. On the 22nd of March, I stood before you and announced that we would implement a social lockdown for all our community. You have done a magnificent job of working with our law enforcement agencies in keeping to the lockdown. You will have to do so for a little longer still, because we cannot yet say that our lockdown has worked. But we can say that our lockdown is working. We have succeeded in reducing the rate of community infections. We have succeeded in ensuring that the GHA has not been overwhelmed by patients requiring care for COVID-19. We have succeeded in rolling out a program to protect businesses and employees in our economy. But I know that the social need to relax the lockdown is greater each day, and the potential long-term public health risk of continual extensions of the lockdown also give rise to their own risks. And the potential long-term economic damage is worse each day that passes. But any relaxation of the lockdown regulations creates a likelihood of increased community infections of COVID-19. For that reason, the pace of relaxation of the lockdown will have to be gradual. It will have to be prudent. It will have to be closely controlled. And social distancing will be here to stay for the foreseeable future. As a community, we have done a great job to date. We calibrated our lockdown to be less tough than in most other places. That means that we have allowed throughout some of the things which are only now being permitted in places where lockdowns are being relaxed. Yesterday, we saw our over 70s out doing exercise. Today, I'm going to announce a measure of relaxation which will come into effect as from the 2nd of May. But our approach will continue to be to prioritize public safety and security by seeking to continue to suppress the spread of the virus as much as possible. This will mean that restrictions will be removed gradually, prudently, and asymmetrically. There is no off switch that can be pressed that will provide a safe and secure immediate return to normality as it was before the lockdown. In addition, the unlocking will require great amounts of sampling and testing. That is how we will identify and isolate both asymptomatic and symptomatic infected persons who may otherwise spread the virus more widely. Without a vaccine or a medicine, the advice which is received by the government is that these are the new mechanisms which must be put in place for normal life to return. Testing aggressively, tracing aggressively, totally isolating those who have come into contact with the virus for a short period. Because we have to be clear that we are going to move to a stage now when we are going to be living with the virus. Remember that the lockdown was not intended to pretend that it was possible to achieve the elimination of the virus by keeping the population in lockdown. So we're going to need the cooperation of members of the public, including our non-resident working population, on testing. We will also require cooperation for effective contact tracing, data sharing, and self-isolation. Only in this way can we start the process of easing lockdown further. All of this will be set out in great detail in a master document on how we Unlock the Rock. This will be a fluid document which sets out a route map out of lockdown. But as the understanding of the virus and the effects of easing lockdown becomes apparent, our route map and our master document may also have to change. Our strategy has to be fluid, not rigid. And that is what our size enables us to be. We can be nimble in a way that larger countries cannot be. And we will be telling you clearly what our plans are. And when our plans change, we will be telling you clearly why our plans have changed, so that you have the confidence that you're getting all your information from a trusted source. So an end to confinement will come, but it will come with the start of a new way of living. In every instance, activity will return to each sector strictly subject to the observation of the rules of social distancing. For now, we will be able to start to slowly unlock the rock in some areas of business activity. But we recognize that some of these areas will need to restart very slowly. So despite the unlocking of these areas, they will still be considered included for the purposes of the Beat COVID measures and will still be able to claim the minimum wage payment for employees that might remain inactive. And all the measures which we announced were in place to relieve all businesses for April will continue in place for May. Let me now take you through some of the relaxation measures which we will now implement. First, let me turn to the retail sector. Shops which have been closed by the regulations will be able to reopen as from Saturday, the 2nd of May. In order to be able to reopen, retailers will need to put in place measures to comply with the rules of social distancing. This may mean that fewer people can be inside a shop at any one time, and queuing outside must be properly managed also. Where the rules of social distancing cannot be observed, masks will have to be worn by staff members in retail outlets. Retail outlets will have to provide sanitizing gels at places of access and egress to shops. And shops will only be able to open initially from 1000 hours until 17:30 hours. Offices and premises operated as estate agents will have to ensure social distancing, but can also reopen as from the 2nd of May. When showing properties, social distancing must be observed by estate agents also, and it is advisable that inside properties, face masks should be worn. Construction sites have remained open in the United Kingdom and Spain, subject to a hiatus of some weeks, whilst in Gibraltar they have been largely closed. Only some sites have been open, and these have required a permit from the Chief Technical Officer in order to operate. At the moment, Gibraltar is the only, or one of the only, European jurisdictions where construction remains closed. More construction sites will be able to reopen with a permit from the Chief Technical Officer as from Monday, the 4th of May. These will be sites that are self-contained. Operation of construction sites will be subject to a permit that will provide very strict controls about access and operation. Construction workers will have to remain on site and move from their homes, or where relevant, from their point of entry to Gibraltar, to the site. Construction workers will not be permitted to leave construction sites during their working hours. And deliveries required for the operation of construction sites will have to be arranged with those supplying materials so that they can be delivered by employees who will not be exposed to those working on site. Interaction on construction sites will have to be, insofar as possible, in keeping also with the rules of social distancing. Where the rules of social distancing cannot be observed, masks will have to be worn even if work is being carried out in the open air. Additionally, access to all construction sites by employees will require control of the temperature of all employees on a daily basis. Any employee who registers a high temperature will have to be tested and will have to self-isolate until results are available. Minor works inside home or office buildings will still not be permitted. We are reopening self-contained construction sites only. Shipbuilding and ship repair will be permitted from Wednesday the 6th of May, but only with strict observation of the rules of social distancing and the wearing of masks. Additionally, access to all ship repair sites by employees will require control of the temperature of all employees on a daily basis, on the same basis as those accessing construction sites. Hairdressers and beauticians will be able to commence offering services again on Saturday, the 2nd of May. Services must be offered on a strictly by appointment basis. This is designed to avoid persons gathering in waiting areas. Persons providing hairdressing and beautician services will be required to wear masks in order to minimize the possibilities of potentially unwittingly transmitting infections to clients. Strict hygiene rules will also be implemented. Personal trainers will be able to resume work from Saturday the 2nd of May, where their training sessions are held outdoors. If trainers offer services to more than one client at any time, they must ensure that each person is at least 2 meters apart. Large-scale random testing will be carried out in each of the sectors which are being eased open. Gymnasiums must remain closed for now. The government expects to be in a better position to reassess the opening of commercial gyms in coming weeks. Restaurants will have to continue to operate as takeaway-only services for now. Our plan next week will set out in greater detail how they may reopen in future. Bars, cafeterias, discotheques and nightclubs will also have to remain closed for now. Again, our plan will set out how we address their ability to return to trading in the longer term. After a pause of 3 weeks, if we see no resurgence of the virus, there can be changes to this approach. In the Gibraltar Health Authority, as from Monday the 4th of May, waiting list patients will be called and screened. Lists will be updated. Relevant urgency levels will be assigned to patients, and urgent patients will be given appointments for interventions as necessary. After a pause again of 3 weeks, other services may be reintroduced. This is as important to the public health of our nation as the approach to the pandemic. There will be no change in the posture on education for now. The detailed plan being finalized envisages the first changes 3 weeks from now, starting on the 18th of May. We're working closely with the NASUWT on these issues and want to progress in partnership with that union on the reopening of education for our children, as we do in all sectors and with all unions, because we are all in it together. This is a battle that we will win as one Gibraltar. That is why we have worked with opposition colleagues in the past weeks and will continue to do so going forward. I've today been in touch with the leader of the opposition, as I have in past days, on these unlocking mechanisms. We worked on lockdown together. It is right that we should work on unlocking the rock together also. And I expect that in the last week of May, we will be able to hold a session of Parliament, although it may not be as extensive as it usually is. But it will be important to see our democracy starting up as much as it is important to see our economy starting up. Next week, our fuller plans will be approved by the Cabinet and will then be published in greater detail. For now, we're moving in a direction which is the one we all want to see, but we are taking small steps. We cannot do more at this stage if we're going to be as gradual in the approach that we want to take. And as we take small steps, we recognize that for businesses, this will be far from business as usual. For now, we will continue to offer our Beat COVID measures, even in the sectors we have started to ease open. We will also introduce next week a new measure we're finalizing, which will provide for a type of Beat COVID measure in the excluded sector also. On reflection, it may be that bringing about the lockdown and holding the virus at bay in March and April may turn out to be the easiest part of this process, because it is clear that the gradual reopening will be very hard indeed. Tomorrow is Workers' Day, the 1st of May. Each year since I was elected, we've enjoyed fun days and speeches on the 1st of May. Tomorrow, we must sacrifice We must celebrate, the sacrifice that workers have made in the past in their fight for rights at work. And in particular, we must celebrate that the safety of workers and the rights of workers are as much the guiding principles for the community's return to economic activity as anything else. Yesterday, GBC held an ad hoc version of its Open Day. I want to thank all at GBC who made the effort to produce that special day of entertainment on radio and television. I want to especially thank them for having collected £168,000 for the GHA. That is a remarkable achievement of which they should be rightly proud. It has raised the morale of the whole nation. I think it has also raised the morale of those working on the front line in our health services. Thank you to all. My dear fellow Gibraltarians, we are still in lockdown. The rules have not changed. There may be more shops open as from Saturday, but normality has not yet returned. Remember, there are now 3 million people infected with the virus in the world. More Americans have died in the United States of the virus than died in the Vietnam War. More people have died in the United Kingdom from the virus than died in the Blitz. So please understand that we are still in the grip of danger, and the steps we are taking are small steps, prudent and careful steps. Do not see them as a license to just go out as normal. You must still not leave your home unless you're going to work, to shop, to exercise, or for other reasons provided for in the law. And if you can continue to work from home, please do so. Please help us by continuing to observe the law. Please help yourselves by continuing to observe the law. Show your solidarity with our health workers and our law enforcement agencies by continuing to observe the law. We are still not stepping back from the declaration of a major incident. Command structures will continue in place for now. But further relaxations of the law will come, as long as we do not see spikes in the infection rate and our health authority being overwhelmed. For now, we must hold on for a little longer. I especially want to thank families of people with disabilities. I know this time is especially hard for you. Today, as we start to ease the lockdown, we can all crack a smile. But we cannot get overconfident. We cannot yet let down our guard. In weeks to come, if things go well, we will all smile again, from ear to ear, with our loved ones, with our friends, and with our Gibraltar once again open for business, for leisure, and for fun. But not yet. Thank you for your attention. I'll now take questions from the media at number 6 Commonplace and from those who are joining us virtually.
Thank you, Chief Minister. Question from GBC. Gibraltar has had far less cases of COVID than Spain, yet the measures of easing down the lockdown appear to be stricter than what Spain has already announced. For example, full construction sites already operational since the 21st of April, and the phased reopening of business in Spain has a 2-week pause period. You've announced a 3-week pause period. So what justification do you have for making the easing of restrictions more severe than Spain? And I also want to ask you about the frontier. Have you had any conversations?
Let me take that question first, if you don't mind, because it's a complex one, and then I'll come to you on the second part that you want to put. The easing that we are doing in Gibraltar is easing from a different base than the Spanish restrictions. So the Spanish government is easing restrictions from a much tighter original base of lockdown, which indeed got tighter halfway through. Remember that they completely shut down construction sites at one stage. The original lockdown in Spain did not shut down construction sites, so the reopening of construction sites in Spain is to go back to the original lockdown that they had implemented and not to continue to be at the heightened state of lockdown that they had provided for a 2 or 3 week period. Also, the Spanish state of emergency, or as we call it, the lockdown, to be generic across the European jurisdictions, provided that you couldn't have your children out of the house, provided that you couldn't exercise. You had different provisions. So what we're doing is moving from the base that we provided, which means that if you ask me why are we continuing to be more severe, well, the fact is that we were always more liberal, to apply that sort of terminology, than the Spanish were in the context of their own lockdown. So you're comparing two different moves away from two different bases, and I think that's why it's difficult to try and set them up one against the other. What you have pointed to is the pause period. The pause period that we are advised is the relevant pause period is 3 weeks. Of course, you have to understand that Spain has gone through a different sort of evolution of the pandemic. I expressed my solidarity on a number of occasions with the people of Spain because of the numbers of deaths there. The different autonomies have had different levels of infection and of deaths. Luckily, Andalusia is one of the ones which has seen less deaths compared to Madrid, etc., and they're our immediate neighbour. But the medical advice is what is leading us, the public health advice is what is leading us to the 3-day pause, the 3-week pause. And why 3 weeks? Well, because the incubation period of the virus and the manifestation of the virus, which is so difficult to discern, is best seen evolving over a period of 3 weeks. So our main pauses will be pauses for 3 weeks. But we may do things in the context of the next week and 2 weeks from now where we're not seeing any immediate adverse increase in infections. In other words, things which are happening now, not which may happen in a week or 2 weeks, may lead us to do something next week. But things which we may see in 2 or 3 weeks from now may lead us to undo things that we have relaxed today. That's the public health advice. I don't know whether the Spanish government is getting different public health advice, but I rely on the advice of Public Health Gibraltar, which is based greatly on the advice of Public Health England and on the World Health Organization's own advice. And
Thank you. Sorry, if I can just quickly ask you my follow-up question was, Pedro Sanchez has said that the new normal will return to Spain at the end of June. Can you tell us whether you've had any conversations with any authority in Spain in terms of what does that mean at the frontier? After June, will people still need to present documentation, proof that they are working in Gibraltar?
So let me stop you there, because I've got a very short answer for you. The answer is no. I haven't had those conversations, and it's not yet clear what it is that Spain intends to do at its frontiers. Indeed, what the rest of the European nations intend to do in terms of relaxing the permission for people to continue to cross the Schengen borders. But what I would say is that in every speech that has been made from Moncloa to the regional authorities, when they have talked about frontiers, they have also carved out an exception for cross-frontier workers, and the majority of the cross-frontier workers going in and out of Spain through Gibraltar. So I think we have to be alive to that sensitivity which has been shown from Madrid in respect of those who cross the frontier here, and the understanding they have had that if people were coming to a place of work here, which might have been closed in Spain, they were still allowed to have the ability to move freely about Spain and cross in and out of their frontiers because they were coming to a jurisdiction where their place of work was open.
Chief Minister, you've mentioned that in the opening of the retail sector shops, there may have to be controls on the number of people that are allowed into those shops and on the queues outside those shops as people wait to access those shops. Will you be issuing any guidance to retailers in terms of the number of people that they can let in, depending on the size of the shop, how they should police those queues outside, and what will you do to ensure that those guidelines are adhered to?
So, we're going to move generally, if I can just take the last limb of your question first. We're going to move generally, not immediately, but soon, into a world where people will have to use their common sense. And you cannot police common sense. And you mustn't expect the law enforcement agencies to be put in the impossible position of trying to enforce something as subjective as common sense, or indeed the principle of a 2-meter radius around each person. So principally, this will be guidance and advice. And look, we've seen how those retailers that have been able to remain open in the period when other shops have been closed have applied that guidance in a very sensible way. There are large stores in Gibraltar that have been able to work out how people should approach queuing into their stores and indeed how they should then go through the stores. That is the sort of thing that we expect other retailers to put in place. It's much easier to do in a large shop than it is in a small shop. There will be great difficulties here, but the alternative is to keep them closed. And we want those who feel that they can reopen, who may have been doing some work on websites or on telephones, to at least have their doors open in case people want to come and collect stuff that they may buy online, or indeed may want to come in and browse something. But we are moving to a new normal. Unfortunately, that new normal will have negative aspects to it. I hope it will also have positive aspects to it, and we're going to rely on people applying an element of common sense in the process. John?
So, Fabian, in terms of these new opening of shops, will any of these shops be given resources to tackle these new restrictions? Is there going to be fines for shops that do not comply fully to them? And will there be inspectors that go through the shops, making sure that they are carrying out this procedure?
To an extent, you're asking me the same question that
I've
just been asked. A lot is going to be common sense. I don't see that we are just going to have to rely on penalties. Look, there may be some aspect of penalties being applicable in some respects if people don't provide the sort of material that we're talking about in terms of gels for people to clean their hands as they come in and out of shops. But look, I really do think that the sort of world in which we're going to be operating cannot rely on enforcement by penalty. We're talking about protecting each other. And therefore, I think we need to be in a different sort of environment, although those penalties will have to be provided in some way. And we are, of course, going to look to retailers to provide their own material in respect of masks and gels, etc. That will be a matter for them in the context which may be relevant to each shop, which may be different. This is not going to be an area where the government is going to be providing. What we are going to do, and I've said already, is in the process of reopening, we're going to continue to permit shops, to retailers, to make claims for those employees they won't bring back, to continue to have them as inactive for now, because we imagine that in the same way as we see this as a gradual process, retailers will see the return to normal business as a gradual process, and at least in the first 3 months, which is the period in which the beat COVID measures have been provided for in legislation for now, we will continue to allow these sectors to make claims as if they were fully included sectors. Can I now go to a question from those who are not here?
I have a question from the Panorama. Much like this year's budget session, which was reconfigured to ease pressure during the present crisis, will the government's election-winning manifesto be heading the same way, or does government intend to publish a new and updated manifesto, taking on board all the COVID-related spending into the next financial year and beyond?
Well, the government, of course, does not intend to publish a new manifesto because the government does not intend to fight an election. And a manifesto is a document that you put before people when you ask them for their vote. But what we have already said is that our manifesto now is not something that is going to be entirely deliverable, and we'll be making statements about what parts of our manifesto we believe are no longer deliverable in the context of what it is that we're going to do. And that's not going to be one moment. We're not going to come out with a statement that says, look, page 6, we're not going to do item 4. Page 7, we're not going to do item 6. That's not how we're going to approach it, but we're going to be able to say to the community there are things in there we are no longer able to do. And if I may say so with respect, I think it's utter common sense that that is the position, because nobody would expect that given what has befallen every economy in the world, and some of the predictions that you see are not exactly rocket science. Everybody's GDP is going to be down. Well, you know, there are ways of expressing that flippantly. It's very obvious that that is the case. Well, that is not the economy in which we were heading into at the time of the general election. Neither could anybody imagine that we were heading into it. But as Joe Bossano has said, our manifesto was deliverable in a recession, but it's not deliverable in a depression.
Thank you. The second question is from YGTV. How does the government propose to bring cross-frontier workers into the test, trace and isolate regime? Will it require cooperation with health authorities in Spain?
So there are different ways of doing that. Our plan will explain that during the course of next week. One of the ways that you will do that is by testing in the workplace. So whatever your place of residence, in your workplace, they're likely to be random testing in some of the sectors, as I've indicated today, and that will deal with those who are there where it is that they may reside. There'll also be opportunities to test people as they come in and as they leave Gibraltar, but in a way that doesn't cause queues, which we're looking at, which may enable people to have the test if they want it, or to be part of a random sample, so that we can assist in the understanding of the virus, both in Gibraltar and in the areas around Gibraltar. And another thing that we may do is to have roaming teams, either from Gibraltar going into the campo by agreement with the Spanish authorities, or indeed contracts with Spanish private care providers who may be able to attend at people's homes in the morning if they manifest with symptoms and they need to be tested, so that they don't need to come into Gibraltar. Much in the same way as somebody who manifests with symptoms in Gibraltar is asked not to come into the St. Bernard's facility or the primary care facility, so that they don't also bring the infection to those areas, and we send a team to their homes. All of that is what we're looking at. Is it possible? Look, nobody has a route map out of this. This is all literally, and I'm being very honest with people because I think that they know it and they understand it. We are making it up as we go along and trying to ensure that we design the best and most bespoke system for Gibraltar and for those who live around Gibraltar. GBC? Thank you.
Can you tell us what plans you have for reopening public transport, given that a lot of people are going to be returning to work? They need assistance in getting there, particularly cross-frontier workers that are coming in. And on that subject, the close contactness in public transport, we've noticed, as you've mentioned today, slight increases now in the cases of COVID. So are you going to step up your efforts to trace, where these cases are coming from?
So if you look at the increases, I wouldn't say that they are slight increases. I would say they are slight detections, because a lot of these detections come from asymptomatic cases, and they come in the random sampling that we're doing. So I wouldn't be too concerned that we're seeing a huge spike. We're not, otherwise we would not be here taking the measures that we're taking. We have no plans at the moment to reopen public transport. Those who have had an opportunity to return to work will have to find a way of getting to work. Public transport is a different sector, and it's a sector that is also potentially problematic. So we're pausing a moment before we take the step of reopening public transport, which is another area that we will have to keep an eye on, which will require social distancing measures, which will also probably have advice as to the use of masks when you're inside a vehicle like a bus, etc. So this is, as you know, not an exact science, and therefore we don't want to move too fast, and bringing back public transport now would be, in our view, slightly imprudent, and we're not going to go down that road.
Can I just pick up a little bit on what Ros was just asking now, and ask you to reflect on the current position in respect of other moments where people congregate, sporting events, training, people going to each other's houses. But after you've done that, if I may, just my question, inevitably we're going to see a jump in figures, aren't we?
Well, let me start with the first part of your question. You asked about people going to visit each other, sporting events, training. All of that is not reopening at the moment. I have not made any announcements about that. All of that is covered in our plan, which will be published next week, and you'll see the pauses that we are proposing there and how we want to see the effect of each of those things and, if necessary, stop. Is there an inevitable increase in cases? Well, look, you might say that that is the obvious result of the step that we are taking. You might say, well, it may all appear to have been obvious, but the way that this virus has behaved has sometimes been entirely counterintuitive. And the more social interaction that you have, surely you'll have more cases. Well, it's also true that we may be dealing with a lot less cases around, and therefore there may be less increases. But I absolutely believe that we may see more cases. The question now is, if you're moving into a world where you're going to be living with the virus and the vaccine has not yet come and the medicines have not yet come, what do you do other than stay in lockdown in order not to see any increases in cases? And therefore the answer is you have to take those steps which you're advised you can take, observe whether the increases in cases which does come is one that you can deal with in terms of the public health facilities, or not. And if you can't, then you have to take measures. But look, if you look at the past 6 weeks, let's be autocritical for a moment, because I think it's important. What have we seen? We've seen a virus that has manifested itself with a few people being mildly ill, not requiring intensive care or intubation in the way that we have seen in other places, and actually being quite manageable in the context of having locked down when we did. So we need to push those levers and observe and know that we can put ourselves in that sort of situation, but in much greater and more relaxed environment.
But explain it to us, in this first 3-week pause, what is the tolerance level?
So that is a different sort of calculation to the calculation which you saw in the conditions which were the triggers to get to the stage. The Director of Public Health is setting out what that tolerance will be in a formula which is being prepared by Public Health Gibraltar. It will be different to the triggers that led us to here. And we'll see that in the context of next week in the document which we will publish. But we have to understand that we're moving into a world where we are saying actively that we will live with the virus. That means that there has to be an element of the virus being reported as being there, because otherwise we will be talking about moving to a world where we unlock only if there is no virus, and that is not something which is realistically possible at the moment.
Okay, Fabian. I made this this week. It came out in the news that in Germany, people were being asked to wear masks within shops, which would be, and those were the ones who would be fined most. Is that being considered within Gibraltar, that people who work in shops are forced to wear masks? And secondly, a second part of my question would be whether there would be some businesses, like perhaps clothes shops, which would be would easily pass the virus more than other shops that perhaps didn't require so much touching of the certain products on sale.
Okay, so in terms of the first part of your question, I think it's answered in my main speech, which you'll get in a printed version now. And in terms of whether a fabric shop is different to a grocery shop or is different to a shop that sells toys, look, I think the prevalence of the virus in any surface is such that if you were exposed to the same garment or the same toy or the same item of food which is covered in paper, 10 minutes after somebody had been exposed to it who has the virus and has coughed or somehow otherwise expectorated over it, you'd be at the same level of exposure. So I think that the level of tolerance of risk that we're going to have in our lives and the care that we're going to have to take in future is going to be what changes the most. So it's an example I don't tire of giving. I gave it, I think, during the course of the last press conference I attended. When you touch something, you don't get the virus from touching it. You get the virus by then taking your hand to your mouth or your nose or your eyes and bringing it into your respiratory system. My grandmother had lived through the Spanish flu pandemic and got home every day, and we used to think it was very funny. She used to take all her clothes off. She should be on the bus, go in the shower, change, and had no tolerance whatsoever for having touched anything without washing her hands, for very good reason. In that world of the 1917 to 1919 the Spanish flu pandemic, they learned those rules. We must learn those rules too. And that will apply to us whether we go to a clothes shop, an office, a grocery shop, or anywhere else. And those are the rules that we have to apply to ourselves to protect ourselves. And we are our own best guardians. We mustn't expect doctors or police officers or firemen to look after us. We must look after ourselves and ensure that we don't take the virus into ourselves by touching something that may have it and then bringing it directly into our mouths. Otherwise, we become less guardians of ourselves and more allies of the virus. Can I now go to a question from those that might not be here?
A question from the Panorama. Since the lockdown, Gibraltar, similar to other countries, has not had the usual high level of activity of patients at the A&E, with less people also attending primary care. As a result, there is growing concern of potential delays in diagnosing serious illnesses like cancer and other type ailments. No one can believe people are not getting sick. Is this a question the GHA should be asking or investigating? why people are not accessing healthcare like before lockdown, and what are the possible repercussions?
Well, we know the answers to that question. We don't have to ask it to ourselves. It's happening all over Europe and all over the world. And that's why, as I've said today in the course of my prepared remarks, it's as much a risk to public health for us to continue not to screen people for other conditions, not just cancer, but other conditions, as it is not to be at a heightened state of alert in respect of the virus. So getting those two right is not an exact science. That's why the GHA today, I've announced, will be starting the process of screening patients, of giving each of the persons that they get in touch with who were on waiting lists a different level of urgency each, and then getting in touch with them to make sure that they bring them in. You've seen the predictions everywhere else. If people are not coming into the hospitals to be treated, then they're going to potentially suffer from whatever other conditions they have. Some of those are not life-threatening. They may, however, be painful, and some of them are life-threatening. So we all have to be alive to that, and that's why the GHA is putting in place a mechanism for that additional screening starting as from Monday.
Thank you. The final question sent in is from YGTV. Is there a danger that despite social distancing measures in places and shops, Main Street itself will become crowded on Saturday? What measures will be in place to ensure this does not happen?
Common sense is the answer, and that's why I've appealed to people's common sense. You're not to go down Main Street just for a walk. You're not to go down Main Street for a coffee because there'll be no coffee shops open. You're not to go down Main Street to socialize because socializing is still something which is actually a potential danger, not a pleasure. If you have to go to a shop, you're now able to go to a shop. There are many reasons why people need to go to shops in Main Street. They may not be as necessary as going to a food shop, but you may have a relative who's going to have a particularly important day. You may want to get something for them. You may need to get something for your own home. So there's a reason for bringing the shops back, but it is not to create an agglomeration in Main Street, even with our frontier closed, of our own people who should still be applying the common sense to themselves that they go out just to shop or as they need to, or to work or to exercise. Now, look, people say that in some instances we may be a little too aggressive in the way that we describe this virus, but I said it during the course of my last intervention. If you're feeling brave, if you're feeling cocky, if you think that the numbers of infections in Gibraltar are such that you're no longer at risk, well, you know what I say to you? Good luck, because 21 days later you may have caught the virus and you may be dead. That's the reality, right? So let's just be clear that we're trying to slowly ease ourselves into a situation where we can deal with the virus, but we still all have to be very careful not to put ourselves in the way of the virus so that it can more easily find a way into our bodies. And creating an agglomeration of people down Main Street would be nonsensical. It would be contrary to common sense. It would be contrary to the spirit of what the government is going to do. And it's the sort of thing that might have to lead us to once again be tighter in the context of the lockdown that we apply. So, ladies and gentlemen, thank you very much indeed for listening this afternoon. This is the beginning of a process, and as I indicated to you during the course of my prepared remarks, it does appear to me that this process may be even harder than we thought the initial process of locking down is going to be. We have to be gradual, we have to be prudent, and we have to be careful. And you are our best allies in that prudence and in that care. Help us to please make this process easy for our law enforcement agencies and help us to make it a success. We will smile again, but we have to be careful as we go through this process. This is not quite over yet. Thank you very much and good afternoon.